welcome back to our YouTube channel. I still remain Adegbite Olushola. Please, if you are yet to subscribe to our YouTube channel, please do so by clicking on the subscribe button as well as the notification bell, so you'll be notified whenever we post a new video. Yes, so today there is this thing that is going around. Like, I don't know why people indulge in this thing actually, but I used to know that it is one of the ways in which our foremothers, our in olden days, they do it continuously for females, and it is known as female genital mutilation. Yes, female genital mutilation. So for those that don't know about this thing at all, I need to explain to you. And if you know about this thing, it is this condition. Feel free to share to us about it. Have you experienced it before, or do you have someone close that has experienced this condition? Feel free to share in the comment sections what you have seen about this thing, female genital mutilation. It refers to all procedure involving partial or total removal of female genitalia, the external part of the female genitalia, or it can also involve other injuries for non-medical reasons. It is non-medical reason, it is non-medical reasons for them to remove it. Like, some people just believe that okay, it will help their child not be sexually active, so that she will not be going around with men, so that she will not be promiscuous. I think this is one of the primary reason why they go into this thing, female genital mutilation. That's the reason why some mothers do. So it is not only done by mothers then in olden days, it's also done by the health workers we have then. So should I say probably ignorance that it will affect the girl child. Yes, there are a lot of people living with this thing, female genital mutilation. So according to World Health Organization, they are telling us that female genital mutilation is violation of the female fundamental human rights. It's a violation of female fundamental human rights. So if there is still this thing happening, please, let's put a stop to it. Let's stop it, because it is wrong. It is wrong. It is non-medical. Yes, it has no health benefit, but rather it gives harm to a girl child. Like, scraping or pricking or doing something injury to the private parts, the external private part of the female. No, now it's just like scarification, like giving mark to someone's face. How hurting it will look like. That is what they are doing. They will cut some parts of the female genitalia, probably the clitoris, the labia minora, the labia majora. It could be tampered with, or the opening, the opening of the vagina will be tampered with, thereby giving some complications to the girl child today. There are a lot of people that are living with this thing though, but if you are still in this kind of environment that they are carrying out female genital mutilation, please put an end to it. It is wrong. It is violation of the girl's child fundamental human rights. So now, going further into it, we have different types of this female genital mutilation. We have the type 1, that is the partial or total removal of the clitoris gland. So the type 1 is total removal or partial removal of the clitoris glands. The clitoris, the protruded part organ, the external part of the female genitalia. So it is protruded outside. It is the part where the urethra opening is located. That is where urine passes out. That because there is passage of urethra on the clitoris. So this clitoris is being partially tampered with. And when it is tampered with, it could lead to a lot of things. I'll come to the complications very soon. I need us to understand there are different types of this female genital mutilation. According to WHO, they gave 4 types. We have the type 1, that there is total removal or partial removal of the clitoris glands. The type 2 is that there is total or partial removal of the pituitary glands, and also the labia minora. So they will tamper with the labia minora. Yes, that's the type 2. Then the type 3 that we have is known as infibulation. It refers to narrowing of the vaginal opening. Yes, they'll probably do something, I don't know, that because I've not seen it, I've not seen how it is done before. But according to the research I've done, they are probably insert some things that helps to shrink or that helps to put the vaginal holes together, making it very narrow. And you know, when the vaginal opening is narrow, you know how it will be painful during childbirth, how it will be painful during sexual intercourse. Okay, now the third type, we have the type 4, and that includes some other practices, some other harmful practices. So the type 4 includes some harmful procedure that are being carried out, such as pressing, making use of the needle to press through the external genitalia. Or also we have the scraping. We have scraping, and it is doing a lot of damages than good. We have scraping and all other forms of injuries that might be done, or procedure that might be done on the vagina. That's the type 4 according to World Health Organization. Now, I need us to understand that there is no health benefit attached to female genital mutilation. Rather, it causes only harm. So now our forefathers and foremothers then in olden days, they just believe that doing this female genital mutilation out of ignorance, they do it because they believe that it will help the child not to be promiscuous. So now I'll be mentioning the complications of this condition. If you look at now, these people that have this thing, female genital mutilation, they are unable to be sexually aroused. They will have low libido. If you are trying to sexually if you are trying to be romantic to them, they are not going to get wet. They are not going to get wet. They will have low libido. When it's time for sexual romance or anything, they will just have no interest in sexual intercourse. Although there are some people that are still having sexual intercourse and they are enjoying it. But when I'm talking about those that have this female genital mutilation, they conk one, like their female genitalia has been tampered with, then they might have this condition: lack of no interest, or lack of interest in sexual intercourse. And also during childbirth, oh my God, during childbirth it is very painful. Some of them they have tear. Some of them, the nurses or the midwives will carry out the episiotomy procedure so that the baby can come outside. That is, they will have to cut part of their perineum, their part of their perineum, so that there will be space for the child to come outside. Some, they have painful sexual intercourse. They don't even enjoy their sexual intercourse at all. So we need to stop this. It is not doing good but harm. So now, talking about the complications of this condition, female genital mutilation, it leads to urinary problem. Like I said, that the clitoris, we have the opening of the urethra at the clitoris, so there might be tampered with it can lead to the urinary problem, in the sense that when they are making use of, and these things they are not carrying out good aseptic techniques. They are not carrying out good aseptic procedure. Like they are making use of this, they are making use of instruments that are infected. They are not making sure that these instruments are uninfected. So it will probably one way or the other infect these things and cause urinary problems, painful urination. Such person will have painful urination, urinary tract infection. Why? Because the urethra has been tampered with. Definitely, these microorganisms will swim through the urethra down to their kidney, down to their bladder, and they will start multiplying, doing a lot of things, thereby causing urinary tract infection, causing painful urination, and so on. So one is urinary problem. Another one is vaginal problems. vaginal problem in the sense that the vaginal opening is elastic in nature, but when it comes to this kind of people, it will not be so elastic because it has been tampered with. So they may have discharge, they may have itching, they may have bacterial vaginosis and other sets of infections. Why? Because there is invasion of microorganisms, and microorganisms, they like it there. They always try to multiply and do their job. They'll start, infecting different kind of stains, different kind of parts in that vagina, leading to infections, the vaginal problems. Another one is menstrual problems. Yes, painful menstruation. Their hormone has been tampered with. So thereby leading to menstrual problems, difficult in passing menstrual blood. Yes, because the vaginal opening where the blood will pass out has been narrowed. Another one is scar tissue. Due to the surgery, the minor surgery they have done, the non-medical surgery they have done, there is scar tissue, and also it can lead to keloids, like a tissue and a fold of a tissue growing up. It can lead to keloids. Another thing is sexual problem. These kind of people, they have low libido of sexual intercourse, and there is always pain during sexual intercourse to them. Then there will be decreased satisfaction. They will not be satisfied because they are not even wet. Another one is increased risk of childbirth complication. During delivery, there will be problems. Difficult in delivering, difficult for the baby to pass out, come out, excessive bleeding as a result of the delivery, and also it can lead to cesarean section. They won't be able to deliver. They have to go for a cesarean section to help them. And there will be at times there will be need to resuscitate the baby because the baby has been distressed and weak. It can also lead to delivery problems. Then another problem is psychological problems, depression. A lot of females are suffering from this condition, and they are suffering from depression inside of them. They have no one to talk to. So depression, anxiety, post-traumatic stress or stress disorder, PTSD, post-traumatic stress disorder, low self-esteem, they will be like, they won't feel among, and things like that. So if you are still in this kind of environment where this thing, female genital mutilation is done, please desist from it. It is not doing any good but harm to the female, and it is violation of their fundamental human rights. Put a stop to female genital mutilation. So, like I said earlier, if you have experienced this condition before, or you have someone that has experienced the condition before, feel free to share in the comment section. Feel free to share in the comment section what you have seen about it, what you have gone through, and lots more. Thank you, and have a lovely day.